Yeah. Okay. This is back to Zoom meeting.
Okay.
Turn off the audio first.
Good afternoon, everyone. Thank you for joining our live session today. So this is our second live session. It's going to be with Dr. Ling Janlung, our orthopedic and sports surgeon. So today's topic is going to be bounce back or bow out, the surgical role in sport injuries. So without further ado, let me pass the floor to Doctor. Feel free to drop your questions in the comment box. At the end of the session, Doctor will address it. Thank you.
Hi. Hi everyone. Sorry for the issue. So yeah, good afternoon everybody. First, I would like to thank the Sunway Medical Center Ipoh for organizing this informative event during this afternoon hour, and also the BDCC team for organizing this talk. I also like to extend my thanks to all the audience out there for reserving your precious time during this lunch hour to attend my talk, and I hope that this talk will create awareness and also benefit your knowledge in treatment of sports injuries. So I'm Dr. Ling Jian Long. I'm the orthopedic and trauma surgeon here in Sunway Medical Center Ipoh, and I specialize in shoulder, elbow, and sole sport injuries. So as we know, I'm going to talk about sport injuries today, and my topic is whether we are supposed to bounce back or bounce out from a certain type of sport injuries and the surgical role in overcoming this type of injuries. So as we know that in this era and also in this generation, all of us are being health conscious, and most of us are doing a lot of outdoor activities, a lot of sporting events such as hiking, bike cycling, marathon, or the up and coming sports where the young and old can enjoy is the pickleball. So when we involve ourselves in this type of activity, we tend to get some sort of injuries from this type of events. So when we get injured from this type of events, we term this as the sport injuries or outdoor activity injuries. So why does it happen? It may happen due to accidents such as slippery falls during a game of basketball, or any contact sports such as rugby, football, being tackled by your opponents, or in the event of you're planning to join a marathon, example of a 42-kilometer full marathon, you tend to train and you overtrain, and it leads to fatigue of certain parts of your body. This increases the tendency of injury. And also sometimes when you are up for a game or up for a leisure game, but you are not being well warmed up, or you have lack of warming up session, this also increases the risk of injuries. So which part of our body that are at risk of injury? As you can see, our muscles, we can cause any strain or tear. The ligaments, same goes, we can sprain our ligament and we can tear our ligaments. The tendons strain or tear, joint dislocation, or bony fractures. So I've divided the injuries of sporting events in the two, the acute traumatic injuries in the bony components. When you get injured due to this kind of injuries at the bony components, which are the joint dislocations or also bony fractures, you have to immediately seek for treatment, as this injury is a bit severe. And if you have dislocated your joint, we will relocate back your joint. And if you have fractured your bone, you either get treated conservatively with a cast, or we have to bring you into the surgical theater, give you some anesthesia, and do a surgical procedure to fix your bone. So in the soft tissue component, there's two terminologies. And this is the topic that I want to talk about and I want to emphasize about in these sporting injuries. So we have two terminologies for soft tissue injuries. For muscle and tendon, the terminology of the injury is strain, and for ligaments are sprain. However, these two injuries are pretty similar one to each another. And how the mechanism of injury of this type of soft tissue due to several factors. Number one is the footing or the positioning of your limb. For example, in badminton player, when you jump and smash and you land on a wrong position of your ankle, in an inverted position, you tend to have an inversion injury of your ankle, which causes a lot of stress over the outer part of the ankle, leading to injury of the ligaments. Another factor is during game, when we tend to change position from left to right, or you try to pivot yourself, this increases the load over the ligament, especially inside the knee. And due to this high load, the ligament can fail. And this is the pivoting injuries. Other mechanisms such as overused tendon or overused ligament mostly happens in players of overhead activities such as badminton players, tennis players, golf players. They tend to overuse the particular tendon, especially in your elbow joint, and in the long run cause an injury due to prolonged inflammation and also micro tear, which can lead to a more bigger tear. And last but not least, a direct force. For example, if you fall down with an outstretched forearm, it can lead to injury to your elbow, where your bone does not fracture, but your ligament tend to fail first. As in this picture, you can see that the ligament of the inner part of the elbow tends to tear. So how do we grade our injuries? We grade our injuries into three: grade 1, grade 2, and grade 3. And as you can see, grade 1 is there's an element of stretching, an element of small micro tears, and because of these two elements, it causes inflammation. This inflammation will then tend to limit certain activities of your daily activity living because of this swelling, also inflammation around the affected area, and also the pain that causes you to not able to move as freely as you like. So how do we treat this type of grade 1 injuries? We treat it with the mnemonic of RISE. So what is RISE? RISE is actually R is for rest. You have to rest the affected area about 48 hours. The second one is I. I is ice packing, where you apply ice 20 minutes to the affected area about 4 to 8 times a day. Compression to help to reduce the swelling. And so elevation about 6 to 10 inches above your heart level. With medication, this type 1 grade injury may resolve and may heal well after 6 weeks. And you may go back to your sporting event or your outing activities at 3 months. Yes. For the other two injuries, the grade 2 and grade 3, these injuries are a little bit more severe, as the size of the tear is a little larger compared to the grade 1, where grade 2 is the partial tear and the grade 3 is the complete tear. These two grades of injuries produces more severe types of symptoms, and it also same goes to a grade 1 injury which has not resolved after 6 weeks. They will present with similar symptoms such as chronic pain at the affected area, limitation of daily activities causing a lot of disturbance to you, and also instability if the joint is affected. So these three symptoms actually will lead to a lot of limitation of you to going back to sports or going back to the activity that you love to do outdoors. With this limitation in your sporting activities and outdoor activities, it will eventually lead to reduce your quality of life, right? So what should we do with this type of injuries? Should we bow down to this injury, say no for sports anymore, no for your outdoor activities anymore, and live a miserable life? Or you should bounce back from this type of injuries and get to perform at the highest potential of your pre-injury state and live a happy life. So this is where the sport injury surgery comes into picture. All right. So what is sport surgery? So sport surgery is actually a surgical procedure or a surgical approach to treat injuries where one sustained during sport or injuries that would limit someone's participation in either sport, outdoor activity, or any physical exertion activities. So in example, in the knee, usually most commonly injured is the ACL. At the ankle, most commonly injured is the ATFL ligament. In the shoulder, shoulder dislocation, which is not stable, with recurrent episodes of shoulder dislocations, or in elbow, due to overuse tendon, causes pain over the inner part of the elbow or the outer part of the elbow, where some of you guys are aware where we call it as tennis elbow or the golfer's elbow. So most of the sport surgery is performed via an arthroscopy surgery. So what is an arthroscopic surgery? So arthroscopic surgery is a surgery where it involves a minimal invasive approach with a camera, which we call it as arthroscope, and with a few working instruments. And we use it to diagnose or treat joint problems, while this arthroscope allows us to have a direct visualization into the injured area. And because of this minimal small surgical wound, the patient can actually recover faster, have lesser pain, and also can rehab better after the surgical procedure. So few examples of the arthroscopy surgery which I perform is on the shoulder, where in the condition of chronic recurrent dislocation of the shoulder, we stabilize the shoulder joint via a Tankard or a Rampisage procedure. Or in a condition of rotator cuff tear, we perform an arthroscopic shoulder rotator cuff repair. In elbow, I do perform surgeries for overuse tendinitis, such as I mentioned earlier, the tennis elbow or the golfer's elbow. We perform debridement over the affected ligament or affected tendon to reduce the inflammation and to reduce the pain. Or in event of a post-elbow dislocation, which causes a lot of stiffness over the movement of the elbow joint, we do a capsular release. And in cases of collateral ligament tear, we will perform collateral ligament reconstruction. So another part of the surgery that we perform is in the ankle joint, where two common procedures that we perform is the cartilage defect procedures or the ATFL ligament reconstruction. And the last region that commonly done via an arthroscopic surgery is the knee. As you can see, the knee has a lot of ligaments. There are few ligaments that attend at the risk of injury, which is the ACL ligament, the PCL ligament, the meniscus, and also the cartilage, which are at risk of injury during sporting activities. And the commonly done procedure via arthroscopic knee surgery is the ACL reconstruction. So this is a diagram of me performing ACL reconstruction surgery. As you can see that I'm using an arthroscope on my right hand via a very small incision into the knee joint, and I can direct visualization of what I want to see in the knee joint through a projection through the monitor. And on the right side, you can see the image on the upper right is the crooked ACL, and the lower right is the reconstructed ACL, which looks pretty straight. This is a short video that I've prepared for you guys to just see on how we want to how I perform an ACL surgery via an arthroscope and via a direct visualization. small picture over the upper left, this graph is being held by two small buttons sitting on the wall of the bone. So why do we perform surgery? Why do we perform this type of surgery for athletes, and why do we perform this type of surgery for active people that go for sports or go for outdoor activities? So as you can see in a joint, this picture is divided into half. One is the stable joint and the other one is the unstable joint. As you can see, the stable joint is pretty fluid. Everything looks nice. Everything looks cool in blue color. But if you see on your right hand side, the joint it appears to be very angry looking, with a lot of inflammation, with a lot of angry cells and a lot of damage to the joint. This is the condition of an unstable joint. As an example, in these two pictures, there are two houses that are being held by pillars. On the left hand side is a house that are being held by 4 pillars, and on the right hand side is a house that being held by 3 pillars. Without any disturbances, these houses can maintain by themselves and they will not collapse. But what about external factors such as wind, all right, or external factors such as some shaky movement, earthquake, or some other external factors which can cause the houses to move? Which house do you think it will collapse first? Definitely the house with the 3 pillars. This theory applies similar to the joint, especially in the knee. So I would like to present one case, my patient who has sustained a grade 2 ACL tear. Initially, he was treated conservatively. However, he is still symptomatic, but he was not keen for surgical intervention. He went back for his sporting event, and subsequently, after a year or two, he came back to me complaining that his knee he's experiencing a lot of pain over his knee joint. He's experiencing a lot of instability over his knee joint that would not allow him to go back to his full potential of football activity prior to his injury. So finally, he agreed for a surgical intervention, and we went and scoped for his knee. As you can see, the ACL has some sort of a partial tear at the insertion part of the shin bone, right? And because of this instability, it causes many more complications, such as you can see on the pointed red arrow, the meniscus has torn. There's a cartilage defect over the shin bone, as you can see on the model that I've circled over the right-hand side. And also there is a cartilage defect on the thigh bone, which I've circled. We have circled over the right side model. And if you can differentiate the normal and also the defect cartilage lesion, as you can see, the normal cartilage lesion is glossy white appearance, yeah, and the defected one is angry looking red color bony appearance. So why do we do the surgery? It's actually to prevent further complications due to an unstable joint. And will surgery actually give you a 100% outcome? That means you do surgery today, after 1 or 2 weeks, you can actually go back to your highest level of sporting activity. The answer is no. The answer is 50-50, but it's not 50-50 yes, 50-50 no. It's actually 50-50, 50 of it is the sports surgery, which is the responsibility of the surgeon, and another 50% is the responsibility of the patient itself to undergo a proper physiotherapy and also rehabilitation. So we do provide physiotherapy and rehabilitation program after a surgical procedure, where we focus on rebuilding your muscles around the affected area by performing isometric or isotonic muscle exercises, static or dynamic muscle exercises. We also include stability training to increase your performance, whereby if your affected area is your upper limb, we will train your upper limb stability, and if it's the affected area is your lower limb, we will emphasize in lower limb stability. For pain, we will have an adjunct therapy such as the ultrasound therapy or the transcutaneous nerve stimulation therapy to reduce the pain and to allow you to perform better and also to undergo a good physiotherapy and rehabilitation program. So in summary, in a very short summary, these are my few slides. Why do we perform surgery for our patients in the soft tissue components sport injuries? Because number one, we want to eliminate the chronic pain, and also we want to improve your daily living activities. That means we want to eliminate the limitation of what you can do in a daily basis, and also we want to restore the stability of the affected joint. With all this being properly lined out, then you can go back to sports and also bounce back from your previous injury into enjoying the full potential of you able to play your sports, the full potentials of you able to go back to your outdoor activities or your physical exertion activities, where this returning to sports will allow you to improve the quality of your life. So the role of me as a sports surgeon, I will always tell my patient that what I do is I would like to bring you back on your feet and into a flow state of your athletic performance. Thank you. So I got a few questions here. If I get injured, how do I know my injury is grade 1, 2, or 3? Okay, so usually in an acute setting when you get injured, it is difficult to tell whether what grade of injury are you. Because once you have injured a particular example, you have injured your knee joint will swell up. There's a lot of pain, and it's very difficult for me to examine your knee. So most of the time, the initial period, we will always start you with a conservative treatment, where we start you with device therapy and so some medications to control your pain. After the swelling has subsided, then we can do a proper clinical examination to determine how severe is the grade of your injury. That means the laxity of your knee joint, and also the joint that are affected, and also to see whether how bad is the clinical outcome. With adjunct imaging, as example, the MRI, you can also see in the imaging how bad or how severe the ligament has been torn or the tendon has been injured. Right, so the next question is, how long does it take after surgery for my return to sports? Okay, so if you have undergo a surgical procedure, as example, maybe a rotator cuff repair or maybe ACL surgery of your knee, the timeline for you to go back to a full potential, that means the highest potential for you to return to sport, is a minimum of 9 months. 9 months, why? Is because you have to go through a few phases of rehabilitation in order for you to regain back your full potential. The first, we divide into few phases. First phase is about 6 weeks. That is the crucial phase. The phase for us to help you to reduce the swelling post-surgery, for you to get back the range of motion of your operated joint, and also there's a minimal strengthening or bulking of your muscle. And then once you have done all that in the 6 weeks, then we progress to a more intensive training. Example, static cycling, treadmill walking, machine exercises to bulk up your muscle. And after 6 months, you eventually will go to non-contact sports. After you are able to perform the non-contact sports, then slowly we'll put you back into contact sports after 9 months, and subsequently, if you are able to proceed, then after 12 months, you are actually allowed to go back, or you can gain back your full potential in your sporting activities. How long is the recovery process post ACL repair? So as I've mentioned, similar to the question that asked in the second question, the recovery process takes about the initial recovery process, which you need aid, or which you need a lot of help. It takes about 6 weeks to 3 months. After 6 weeks to 3 months, then you can be off of your crutches or external aid, and then we'll slowly put you into the rehabilitation program, and hopefully by 9 months you can go back to your sporting activities. So how can we distinguish between minor strain versus serious strain that needs urgent attention? Okay, so this question is also similar to the question number 1 that I've explained just now. We can't distinguish at the initial phase. So if you get injured, example, you twist your ankle, or you twist your knee, or you fall down and you have pain over your shoulder, the first treatment is always conservative treatment, where we always apply the RICE therapy. So once everything has subsided, once the angry phase has reduced, then we can clinically examine you, and then we can order further investigation for you to do the MRI to see how severe is your injury. Does it need urgent attention? Yes. Once you have sustained an injury, you should approach to your medical treatment, seek any medical treatment, so that the initial phase of the swelling and the pain can be controlled. And then only after, as I've mentioned, it's reduced, then only we can properly examine how severe is your injuries. Either it's a grade 1, it's just a normal sprain, or grade 2, which partial tear, or grade 3 is a complete tear. All right, the last question: protective gear like ankle guard can prevent injury. In some certain extent, it do, but to prevent 100%, no. It's just, it end up maybe about 10 to 20% of what you have, what your body can sustain. But to prevent 100% by wearing a protective guard, maybe it will not reach until 100%, but maybe 20 to 50% of preventing an injury to the protective area. Yeah. All right. So I think that's all for now. Thank you for attending this talk today. I hope that it has been informative, and it has benefit your knowledge on sporting injuries, and what are the roles of surgical intervention by means of overcoming all these sports injuries, and to help you to return back to your sporting activities. I would like to pass the floor back to Ms. Divya, and thank you once again.
So I hope you had a great session with Dr. Ling. So we had a few questions in the comment box, and I hope we have attended to all the questions. So if you would like to visit our Dr. Ling, his clinic is located at level 2, suite number 19, and the general line would be 05-871-1919, extension 78110, and the clinic operation hours Monday to Friday, 8:30 to 5 p.m. and on Saturdays, 8:30 to 1 p.m. We are closed on Sundays and public holidays. So I hope this was a great session and sharing by Dr. Lee. So we would like to adjourn the session. Thank you, everyone.